Dr. Taggart, one of the things that I've had an opportunity to participate in, and I've always been a huge fan of, is group therapy, and just kind of that round table, a bunch of us kind of sitting around with a therapist or a clinician there discussing different things and kind of moderating. What are your views on group therapy as kind of a treatment or having a therapist as a facilitator? How do you think that can help, and how have you kind of used that in your practice and in the past?
So my first response on this should be, this is true, of course, of all of our videos. Is they're not to be construed as advice for particular. They're not to be construed as medical advice, for one person. Um, and I say that uh, pointedly in this case because group therapy can be extremely helpful for certain conditions, certain people. And it's not so proven to be helpful for certain other people and certain other conditions. So you should be sure to follow the advice of a good mental health clinician who knows you and knows your particular set of history and personality type and that any struggles, any conditions you may be struggling with, knows that whole global picture, and then they will know whether group therapy is right for you given their knowledge of all those conditions. So having said that, group therapy, you're right, Adam, can be tremendously helpful. I know many folks like yourself who just have walked away from group therapy experiences or are still in group therapy experiences thinking that, my gosh, it made my life so much better, so much more happy or healthy. Um, and so, for the right conditions, for the right people, group therapy can be the treatment of choice. So, there are a couple of conditions that come to mind that group therapy is really very, very commonly super helpful for, and in many cases, the treatment of choice. Treatment of choice doesn't mean that it's the only treatment. So please do not take this as uh, me endorsing that you should only do group therapy for either of the conditions that I'm about to mention. So again, this needs to be bounced off your own clinician, and they'll know where to guide you. They'll know where, if anywhere, group therapy fits into your particular treatment plan needs. So having said all that, group therapy can be tremendously helpful for a couple things. One that comes to mind right away is post traumatic stress disorder, which is, as folks may know, sometimes abbreviated as PTSD. And post traumatic stress disorder is generally, for folks who don't know, it's generally thought of as an uh, anxiety or stress response to trauma, whether that trauma was witnessed or directly experienced. Uh, the result of it is that the patient, the sufferer of PTSD, has an ongoing stress and trauma responsiveness to them that is marked by a lot of anxiety, um, an inability to control that anxiety, and often a lot of re-experiencing of the trauma in various ways, excessive worries about traumatic events happening again, and there are other features. So, post-traumatic stress disorder can be treated by many different interventions, and they can be quite helpful. There are medications that are known to be helpful for PTSD. There are individual therapies, talk therapies that are known to be effective for PTSD. and uh, and those probably should be a part of the treatment planning for anybody who's suffering from very significant PTSD. we often want to bring to bear anything we can, to help these folks get better. But group therapy tends to be so often exquisitely helpful for PTSD sufferers. And it seems to be around the following core issue that sitting in a room with the most trained psychiatrist or psychologist or therapist in the world who has great knowledge of the various individual talk therapies that can be used for PTSD, and perhaps great knowledge of the medicines that can be helpful for PTSD. That tends to be less helpful than sitting in a room with people who really, really understand, who have, who have experienced very similar, if not identical, trauma to the patient in question. The act of being in a room where the trauma sufferer, the PTSD sufferer, can realize, hey, wow, I'm across from the room from somebody who really gets what I'm going through. They're not just cognitively understanding it, they've lived it. They really have the same feelings, the same reactions that I'm having, or at least very, very similar ones. They really get what I've been through. So having that in a room along with an extremely trained therapist who knows PTSD, who knows the treatments for it, individual and or group, th- that combination, that so group therapy with people who who are who have been through similar trauma in the hands of a trained therapist can be so commonly tremendously helpful for PTSD sufferers. Um, it tends to be something that is commonly recommended by therapists for PTSD, and so that's a situation where it wouldn't surprise me at all that a good therapist is, strongly suggesting to their patient to to get to group therapy for PTSD. The other condition that very commonly is known to respond quite well to group therapy is either social skills deficits, such as in uh, autism spectrum patients, or social fears, social worries, social anxieties. Those social struggles can be so tremendously helpful to eh, um, uh, for the folks who have those struggles to be in a group therapy setting where a trained therapist in this particular type of group therapy can structure the group such that social issues come out in the right therapeutic supported ways. Let me give you an example. So, it would be very common for a therapist in a group therapy session directed at help with social issues. It'd be very common for the therapist to say something like, Adam, I can see that you were hesitant about speaking with Susan over there. I don't know if you realized, Adam, that Susan was wondering if you were um, uh, experiencing the same thing that she had experienced. And I think she was trying to say that to you. And I don't know if you realized that Susan smiled. What your eyes were down, and maybe that was Adam. Maybe it was because you were anxious. I don't know, but I think you actually might have missed that Susan smiled at you when you introduced yourself to her. And so here's, Adam, what I would suggest you might want to say to Susan, um, the next time this comes up. And what I'll do, Adam, is when and by the way, discussions like this can sometimes be best had with the patient outside of earshot of the group. So it's not uncommon for a therapist in group settings working on social skills to be, when needed, pulling patients aside. But so what might happen here is the therapist would then say to Adam, "Hey, Adam, let's go back into the situation, and I'll try to set things up so that you have another opportunity to ask Susan the same question that you asked her. And here's what I want you to do. I want you to try to have your eyes on Susan's face because I think you'll get a positive response. I think she's actually interested in talking to you about this topic. It might surprise you to see that in her face, but um, and I want you to sort of try using this set of words that I just happen to know as a therapist are the kind of words that I think will be sort of icebreaker words for for you to kind of open up a discussion with Susan. And by the way, what I might do with Susan before that situation happens is I might leave Adam and go over to Susan, and I might say to Susan, "Hey, Susan, Adam's going to approach you in the following way." And I think I'm right, Susan, that you're interested in talking to Adam about this, right? Great. Hey, that's great to hear you confirm that. So what I'm suggesting is uh, this response to Adam. Does that feel like something you'd want to say to him? And oftentimes, Susan will say yes. And uh, generally speaking, the therapist has a sense of their patients and what they're looking for. And so my point is that I can sort of hand or put in Susan's lap her own sort of icebreaker, uh, um, uh, prefab uh, conversation piece that can be the kindling that gets the conversation started. And then so I bring these two, Susan and Adam, back into the group, and after having uh, coached them in ways like I described, and typically now they can have a successful social interaction that surprises each of them and helps allay their fears, helps give them the confidence that, hey, wow, I actually can come back to a social situation that kind of felt like failure before. And with a couple of, techniques, a couple of phrases handed to me, a couple of phrases that I can keep in my front pocket for similar situations in the future, I was able to, the second time around, have much more success in that social situation. Hey, wow, you know, in sessions, in group therapy session, 2, 3, 4, and 5, the same thing happened. Wow, what I'm starting to get as a patient is Adam, am starting to get self-confidence about my ability to actually begin to step out more socially and maybe not have success all the time, which is not necessary, by the way. We'll come back to this in a minute, but having success all the time is actually not the best thing for social anxiety sufferers. But so in any case, with repetition, session after session, what happens is these former social anxiety sufferers get the antidote for anxiety, which is confidence from experiences that started out as very structured by the therapist. But because both ends of the conversation could be managed by the therapist, managed some to some degree off screen and some to some degree, while it's happening, because that happened, then successful results can happen often enough to generate increased confidence. And the last thing I'll say is the thing that I promised to come back to, and that is that one can really get better confidence, self confidence in the long run if they have a few experiences where, you know what, that didn't go perfectly. And actually, what tends to happen is as long as it's mixed with s- some degree of success, some frequency of success. What can what can happen reliably is the former anxiety social anxiety sufferer begins to have thoughts like, "Hey, you know what? That didn't go so well, and that other time it didn't go so well either. One of those was actually kind of embarrassing." But what they realize can happen is they can come back to it and have success the next time. They can fall flat on their face, which is just uh, um, it- stressful for me as a therapist when I see it happen because nobody wants that for their patients. But that can give them grit, and it can give them the ability to be like, okay, skinned my knee, bruised myself, but the world didn't end. My worst fears, and typically folks with social anxiety can have very, very what we call overwrought fears, but fears that are just really beyond what would be likely to happen in social situations, really just catastrophic. We some therapists call it catastrophizing um, this kind of thinking. They can have very catastrophic fears, and so when they when they have a situation where they just do not do well, it actually can really help allay their fears because they realize the world actually didn't end. They turned out okay. That person who they were talking to, they came back to the next session and had a successful interaction with them. And now that a few more sessions have gone on, they've had 3 successful interactions with them, and so life can go on after failure. That's such a key confidence building message, that can happen in group therapy sessions that are designed, shaped by a skilled therapist in this area. But again, the group to come back to your question, Adam, the group is the crucial uh, raw material ingredient that the good therapist needs in order to orchestrate situations that help social anxiety sufferers get better.